I want to thank everyone for participating in our COVID-19 and coronavirus education today. Today we're going to be giving you an update on COVID-19, and we're also going to be talking about how this affects kids. We have one of the top pediatric infectious disease doctors with us today, Dr. Marcelo Laufer, who's going to give us an update on what's going on with COVID-19 and also share some input on how it's affecting pediatrics. And also we're going to dive into a very recent update of a study out of China, on kids, which looks like it changes a little bit of our perception of are kids safe or are they not? So with that, Dr. Laufer, I'd love for you to introduce yourself and jump right in.
Yes, so thank you very much for inviting me. My name is Marcelo Laufer. I'm a pediatric infectious disease specialist in Miami at Nicklaus Children's Hospital. Nicklaus Children's Hospital is a solely pediatric facility, which makes us unique in the fact that we are not seeing adults who are sick, and that gives us an advantage in a way to children's hospitals who are now seeing both pediatrics and adult patients. I'm a graduate from the National University of Asunción in Paraguay, and I did my training at the University of Miami a few years ago. I did pediatrics, pediatric infectious diseases, and pediatric immunology. And here I mainly have a clinical work as a clinician in infectious diseases, but I also have a role in the pharmacy. I'm the chair of the pharmacy committee, the chair of the antimicrobial stewardship committee, and very involved with infection control and in the epidemiologic planning on how we're going to be handling this epidemic or pandemic right now. So it's really interesting times, the ones that we're living right now. If you think about it, this is the first disease in which we have a live dashboard of how many new cases we have, how many new deaths we have, live information through the internet to everyone of what's going on in your set of the world where you live, and that it has advantages and disadvantages. If you think about it, from the time that we diagnosed HIV in 1981 to the time that we had a PCR, which was 1995, 1996, it evolved a number of years. In this particular illness with coronavirus, probably we were expecting that from the first two epidemics of the SARS in 2003 and MERS in 2009. The disease was first described in mid-December, late November, and by January we already had a test. Our first case in the United States was in January 19, 2020, and it was actually a 35-year-old male who was completely healthy, who had just traveled back from Wuhan to his visited family in Washington State in the west region of United States. He had arrived to the United States on the 15th of January, and he had symptoms of cough and low-grade fevers. He presented to the urgent care center. They did a chest X-ray, which was negative, influenza test, which was negative, and they did the respiratory panel PCR, which, as you know, will detect most common forms of respiratory infections caused by viruses, including the coronavirus non-COVID-19, or also known as SARS-CoV-2. And the RPP for this patient was negative. So by the next day, obviously these people were very concerned with migration from China to Washington State. They had contacted the CDC, transferred the sample there, and he was confirmed to have the COVID-19 virus. He was admitted to the airborne isolation unit of the Providence Regional Medical Center, and we have very detailed description of his symptoms. Day 1 to day 2, he had dry cough, nausea and vomiting. Day 2 to day 5 of admission, which already there was day 6 to day 9 of the illness, low-grade fevers were recorded and tachycardia, 1 episode of diarrhea. By day 3 of admission, which was already illness day 7, the second chest X-ray was still normal. And by day 5 of admission, which is day 9 of the illness, now there was evidence of pneumonia. I'm sure that if we do a CAT scan of the chest early on, we're going to find the typical evidence of ground glass opacities that you could see in these patients, and might predict that the patient was going to be in need of oxygen. This patient, since he was the first patient, he had access to everything. We might not have the luxury of having access to everything right now. So he was treated with remdesivir, and he was started on that medication on day 7, which was illness day 11, and the patient's clinical condition improved and he was discharged home. Now, with the COVID 2019, the first article that I had access to was the one published in the New England Journal of Medicine. And the point of this article was the following. What they did is they looked at all the patients who had been admitted to different hospitals in Wuhan with respiratory infections between the week of January 7th to January 15th. So basically 8 days of admissions in Wuhan. And there were a total of 366 children. And out of these 366 children, there were 360 who did not have coronavirus, the 2019 strand, but had something else, like influenza, RSV, other coronavirus, the viruses of the community. Common among those 6 patients, what they had were high fever, all of them, cough, all of them, vomiting, 4 out of the 6, and pneumonia, 4 out of the 6, and 1 required ICU, and none of them died. So up to yesterday, that was one of the few reports that we had descriptions in children. Now there is an online article from Pediatrics. Pediatrics is a journal that belongs to the American Academy of Pediatrics. It's not yet published, the article, but you can find it online. You go to a website of the American Academy of Pediatrics, aap.org. You look under publications, and you look under pediatrics, and they just search for coronavirus. You're gonna find the article in the PDF format. And what they are describing is basically a description of what had happened in China in terms of pediatrics patients. And what they are describing 2,143 children who were diagnosed with coronavirus 2019 strain. Not all of them were tested. So not all of them had the PCR. So 731 were confirmed by PCR, and the other one were diagnosed clinically. So it's just they assumed that they did have the coronavirus 19 because they did not have another alternative diagnosis, and they have the symptoms that were suggestive of that. The mean age, or the median age, was 7 years of age. Fortunately, the data shows that they only had 1 death. So the mortality rate is much lower than the one described in the adult world. But the severity was a bit higher than originally described by other studies. They divided the patients into asymptomatic, mild, or to moderate symptoms, and up to 38% of the patients were considered moderate illness, and 6% of the patients were considered severe illness requiring ICU admissions. So we were telling everyone that the pediatric patients were going to be mostly asymptomatic, but this study gives a little bit of more reality of what really did happen or is happening in China. So even though we still believe that the pediatric population is going to have a less severe impact than the adult population, that doesn't mean they are not going to get sick. So I invite you to visit the website of the American Academy of Pediatrics and try to retrieve the article so you can go through the details of the article. The virus can be shed in saliva, can be shed in respiratory secretions, can be shed in vomiting, and can be shed in stool. So right now we're doing mostly droplet precautions. But when you're going to be handling a patient and you're going to be in very close contact with them, like if you are going to be an anesthesiologist or you're going to be suctioning the patient, if he's on the ventilator or you expect to be a splash, then in those cases there is a recommendation to treat it as an airborne disease, but mostly we're treating this as a droplet disease. And it's a huge difference because droplet precautions you need is regular surgical mask, and airborne precautions you need an N95 mask. And as you know, everyone is being affected by the lack of access to this type of equipment. So this is just a picture of where the epicenter of the epidemic started. I think that most of you did follow this. They had restricted significantly the movement of people. This is a very dense area, and the higher the density of people and the higher the contact of people, the higher is going to be the risk for transmission between the people. And the more people get infected, the more people are going to infect to other people. So at this moment, we don't have a vaccine, as you know. So the only defense we have against the virus is either getting infected, severely infected against it, or better, containment and stay in our homes. Quarantine has been successful in decreasing the number of new cases. Why 14 days of quarantine? This is just one of the many studies that explain this. And I want to emphasize that I'm so grateful and so surprised at seeing the number of articles being published so fast that it is really I want to commend the editorial boards of the different journals, which did not go through the editorial process that normally take place, and they were able to give us information to all the medical community outside of China of what was going on. So, it's very difficult to publish in the New England Journal of Medicine. The amount of articles that we had available to us really are educating when we are just waiting for the patient now. So this is an article that was published in New England Journal of Medicine in the 12th of March 2020 edition. And it describes what the country of Singapore did for their nationals. So they had 97 patients or 97 nationals from Singapore in the area of Wuhan that they wanted to bring them back to Singapore to protect them from the epidemic. So 97 people, they sent a charter plane, 97 people showed up at the airport. 3 of them had fever, so they were not allowed to board the plane. 94 people boarded in the plane, and everyone in the plane was placed on a mask. By the time they arrived to Singapore, every person before getting off the plane had temperature taken again. And 2 of the 94 people had fever upon arrival to Singapore, and they tested positive for SARS coronavirus 2 virus, and they were isolated from the other 92 non-febrile patients. Those 92 non-febrile patients were between the ages of 2 and 82, were quarantined for 14 days. 6 persons reported symptoms, and all of them tested negative. On quarantine day 3, samples from 86 of these people who were asymptomatic were tested. 1 17-year-old male tested positive and had no symptoms, and he remained positive by means of PCR for 2 weeks. and another man, 41-year-old, had an inconclusive result. And this type of data of people being PCR positive on a daily basis for up to 2 weeks is the basis of us saying quarantine for 14 days. That's where the magic number of 14 days comes from. So who's at risk of getting this infection? Well, for once, people who are going to have severe disease are going to be older people. The population that I'm a pediatrician, so the population that I do not work with are going to be at much higher risk than the population I work with. We had a very sad event of massive infection of a number of patients in a nursing home for older people with a very high mortality rate. So that was an event, an unfortunate event from which epidemiologists have learned a lot of how to handle nursing homes. Immune-compromised patients are, of course, at higher risk from any infection, among them this particular virus. Patients with chronic lung disease, patients with COPD, smokers, patients have been affected by vaping. So young adults who have been affected by vaping going to lung fibrosis, those are the patients who are very concerned about. Patients with chronic kidney disease, patients with chronic heart disease. Now, there's a large number of patients now in the United States and the world with autoimmune disease who are on biological medications such as Remicade, Humira, Enbrel, etc. They are going to be at higher risk. Patients with leukemia, patients with lymphoma. In pediatrics, my concern are patients who cannot move well, who cannot handle secretions well. So patients with cerebral palsy, who with intellectual disability, who have poor deglution mechanisms, patients who cannot clear respiratory secretions well. But at the end of the day, anyone can get sick. A healthy adult between the ages of 25 and 40 years of age can be the next patient who is admitted to the intensive care unit where you are working at. And we do know that children in general are at lesser risk of severe disease, but from what we learned from the pediatric study done now in China retrospectively, the one that I had mentioned 4 slides before, children can also get affected severely. And children are also can be the source of infections to their adult parents and grandparents. What about treatment? People always ask me, should I test if I don't have any symptom? So at this moment, we have very limited testing, and that has significantly handicapped our effort to try to stop the epidemic. But even if we did, or when we do, which we probably will the next few weeks, testing asymptomatic patients other than ordering quarantine will not individually benefit the person. Because right now there is no medication or vaccine that we can provide to the patients for them not to become sicker than usual. There are vaccine trials that have been started now, both in the United States and outside of the United States, but I doubt that we're going to be able to use those vaccines in a massive way before we have data on the vaccine. So the available treatment is mainly supportive. IV fluids, oxygen, nutrition, ventilatory support was needed. We here in the hospital made a big effort to stockpile inhaler because we want to minimize the use of nebulizer for many reasons. But the main reason is that inhalers are as good as nebulizers to control reactive airway disease, and it decreases the exposure of the patients to respiratory therapists who are going to be working with other patients who are not infected. There is an antiviral drug, remdesivir, which is not yet approved. Therefore, you're going to have at your institution somebody who had to be certified through IND to be able to use the medication. Hydroxychloroquine is being used as an anti-inflammatory agent. There is some experience with Calitra, with SARS, that has some activity on the virus, and people are using Calitra. Results yet not available to us. In antibiotics, only bacterial infections are suspected. We have to be very careful with the use of antibiotics, as these patients who are already chronically ill had been exposed to antibiotics before, and the least that they need is on top of the infection. The least that they need is being complicated with antibiotic-associated diarrhea, such as C. difficile infection. So what should we do? We physicians, we organizations, we doctors, we administrators of the hospitals, we have to be available to our patients. We have to be a vehicle for them not to need to leave the house. We live now in an era in which deliveries are a common day thing, and coming to the doctor can be with the doctor being available to the patient in their comfort of the house without them leaving the house. So we have to establish a mechanism to talk to them on the phone, design or designate one person in the group to do telehealth through video calls. I was talking yesterday to a pediatrician here in the community, who is actually the pediatrician of my granddaughter. They're doing 80% of their visits by telehealth. And you have to decrease the number of routine visits by now. Don't bring any patient that doesn't need to be seen immediately. Minimize waiting room time. And those patients who are suspected to be infected with coronavirus too should be met in the designated area with appropriate protection for the person caring for the patient and for the rest of the patients. One of the hospitals in Bergamo, Italy, had reported that at some point they had 450 nurses who couldn't come to work because they were quarantined because they were sick, because of previously inappropriate cohorting of patients in not appropriately designated areas. With that, I like to just put this last slide and open the Q&A for you. What do we do with the exposed patients? So if there is a certain close exposure, meaning I was in contact with somebody who had COVID 2019, I have to quarantine myself for 14 days. I have that responsibility to my family, to my colleagues, to the community. Now, if I do not have any symptoms and I want to be tested, I shouldn't be tested. There is no reason to test those people who did not have a contact and who have no symptoms. If there is exposure to a person who is confirmed to have possible or confirmed case of coronavirus SARS-2 PCR, then that person should be tested. If the test is negative and the patient has no further symptoms, no further action is needed. If the test is negative but the patient worsens in his symptoms or her symptoms, we should repeat the testing, because the testing is very good, but it's not 100%. There are testings that are rapid in 2 or 3 hours, that the sensitivity is slightly lower, but also depends on the viral load of the testing. When you test, it is very important that you swab the nasopharyngeal area, the throat, and the saliva. You don't need to do 2 vials. You can use 2 swabs in 1 vial. If the test is positive and the person does have symptoms, you need the person have to contact the personal physician. That's where telehealth comes so handy, because if that person has an interview with the pediatrician or the internist or the cardiologist, the doctor might be able to tell the physician whether the patient whether he should or she should go to the hospital. I imagine that by the next week, most hospitals are going to have designated areas outside of the emergency room, so we can cohort those patients and appropriately screen them to the appropriate area. So with that, I would like to open to questions. I don't know if Jonathan, if you have any questions.
Yes, thanks, Dr. Laufer. So 14 days, is that definitive? Meaning, like, will we find at a later point in time that maybe people had to be quarantined for more than 14 days? And then you hear stories of people leaving quarantine, and then they test positive later, and then, some of what I'm being told is they don't know if they're being reinfected with the same COVID-19 strain or are they getting another strain. So, what are your thoughts of that aspect?
Tough question. The only advantage of testing those people who are asymptomatic, who never had a symptom, is those who are positive. They will unlikely be positive again from experience from the previous epidemics. So the 14 days, at some point you have to draw a line of what you're going to do. And that was based on people who were actually infected. But you bring a very good point. So I was quarantined for 14 days, and then I go to the emergency room and I get exposed again to somebody with infection. So at that point, I might need to be quarantined again. So that's where some places decide on lockdowns, which are extreme measures. In Israel, for example, what they're doing is they go beyond the quarantine, because what they do is if you have been exposed to coronavirus 2019, and nobody else in your family had been, if you go home, you have to be quarantined by yourself in the house. Nobody else can be in the house. But if your family choose to stay with you in the house, then the whole family has to be there for 14 days. Nobody can leave the house. So each public health officer will have to make difficult political decisions based on this and based on the new numbers as they come.
And I think we could see that across whether the country or the world. You can see countries who make very hard decisions early on, and then you see countries that don't. I know, like Spain, right? They decided, but we see what's going on in Italy, but we're not going to cancel concerts, parades, everything. And now Spain, it's rising significantly in cases. What would if I were to get COVID-19, or you would you stick to a 14-day quarantine yourself, or would you say I'm going to add a couple days or a week to it?
I would do 14 days with the information I have at this moment. I think the healthcare workers should have a negative PCR before coming back to work, but that is very difficult that is easier to say than to do. I think that if after 14 days of being exposed I have no symptoms, I should be allowed to come and help to my patients. If by the 14th day I'm still positive, probably the viral load that I have is significantly lower than the viral load that I had on day one. Mm-hmm. Viral load means what amount of virus do I have in my body secretions. And it's very well known that early on, like 2 or 3 days before having symptoms, and the first 5 days from onset of disease is the highest number of viral loads that you're going to have in your body secretions if you're infected. So by day 14, I significantly decrease my risk of transmitting to other people.
And you were talking about, healthcare workers being infected. One question I have with you with that is how big is this going to impact the healthcare side? Because in China and then in Italy, the hospitals have become coronavirus hospitals, and I think that a lot of people in the US don't understand, the impact that their hospitals, may not be available to them for emergent care because they might be, a COVID-19 hospital, and also the impact to, I know in the one Lombardy region in Italy, 25% of the nurses and doctors ended up getting COVID-19, and then they became the patients. And how, what should people expect of what's going to happen in the hospital setting? I told one of my employees who's having a baby very soon is, you be prepared, if that hospital is 100% focused on COVID-19, is there a chance? There could be a chance that they're not available to deliver your baby. You just need to be prepared for these things, or you get in a car accident. These are things that I think is very not comprehensible probably to us here in the US because we've never had to deal with a situation like this before.
Yeah, we are living very, very interesting times, to say the least. And we're going to have to adapt to a new reality for the next 2 months. I think that if we do respect what they are telling us to do, we are not going to have as a big impact than if we do not respect. I have been extremely pleased with what I've seen in my neighborhood, where I live in Miami, where the people are respecting this. The people are not going to restaurants. People are minimizing exposure to supermarkets, are using more deliveries, and are trying to minimize exposure. Is with a virus like this, where it's so easily transmitted, it is extremely difficult to completely contain the virus. And what you're saying about the hospital is very true. We have grown to be accustomed to be able to go to the place that we want to go, where we want to be comfortable. That might not be the case in the next 1 to 2 months. So far, in the region where I'm practicing, we are not experiencing the need to direct patients to places that they do not want to go. I have been given the opinion to most of my patients and my colleagues to avoid going to places where they can get sick. That would be emergency rooms, hospitals, and doctor offices unless they need it. Routine visits can wait, dental cleaning can wait, car wash can wait, and so many other things can wait. You know, our car can be dirty for the next month. Our teeth might need 30 more days for us to have our scheduled dental cleaning. I think that this is a time in which we should use our common sense and try to avoid infection.
Mm-hmm. I think that's, I think those are great examples. I mean, I kind of get blown away. I mean, just a few days ago when I was getting some last supplies, the car wash line near my office was full. And I was just like, you know, I guess that's a priority for some people, but I'm like, that shouldn't be the priority. One of the things, I mean, you mentioned, you know, being, you know, people staying away from each other, respecting each other. You know, I keep, you know, reading stories in the news, but also talking to individuals who just dismiss this, you know, whether they're breaking self-quarantine. You know, in one state, they had to put armed guards around someone's house because the person kept breaking the quarantine. I had a colleague of mine who wanted to go to New York, you know, for a trip, and it was a couple days ago, and he was meeting with an Italian company there. And I had to meet with him 3 times to convince him not to go. He thought it was crazy not to go. I have another colleague who flew to New York a couple days ago to run a marathon, and you know, sent me pictures of look how cool this is. Times Square is empty, and you know, and I feel like there's a disconnect with these people of they're actually going to be the carriers and spreading it to people in different states and loved ones, and there's a lack of, I think, seriousness of how this, you know, how fast it spreads from one person to others and others. And, you know, especially when you talk about kids, I think people don't understand the implications. We put out some infographics for our coronavirus training program, you know, that would show examples of, hey, you know, your kid's sick with COVID-19 and you think they're totally safe. And then they give it to their friend, they meet with their friend and they get that friend sick. And maybe that friend goes sees her aunt who has cancer, you know, and now, you know, she has a high, you know, an unacceptable rate of potential fatality because of that interaction, and the social responsibility of saying, you know, even if you think you're invincible or this doesn't affect you or your kids, you have a responsibility because you in the end could be killing other people, you know, down the line. And I think there's a disconnect with people in seeing that.
I agree. I do agree with all those statements. I know, look, I was probably a few months ago, I was saying it still think that the damage done by influenza that kills so many more people than the coronavirus so far. We do not know how this is going to end. We do not know the score, if you will. But it's not a competition between influenza and coronavirus. The difference is the influenza, we know what happened every year, and this one is the unknown. For influenza, we do have things that we can do for the patient. We have 3 different groups of antiviral agents. With influenza, we know that the viral pneumonia is not as bad as the viral pneumonia caused by coronavirus. The coronavirus viral pneumonia is a significant one and can lead to pulmonary fibrosis and the need of lung transplant. So I do understand the economic damage that this is going to have in everyone. I think there's so many people who are gonna lose their jobs. I'm gonna have friends and family and very close families who are in the field in certain jobs that they're probably gonna lose their jobs, and we're gonna have to, for now, have a different life for the next 2 to 3 years until we rebound for this. But it's just difficult to monetize this situation. And had this started in a different place, maybe the situation was going to be much worse. The fact that it started in a place, in a geographic place where the government can freely impose to the people the restrictions that they want to do without much resistance, maybe control the epidemic more than it would have happened in other places. So, and the other thing is, like, I live in Florida, okay? Our main emergencies are hurricanes. So we have 2 or 3 scares per year in which we have to all stay home for 2 or 3 days, and many times the hurricane doesn't come. And then you always see the journalist who is doing an interview to the guy who is in the beach surfing and saying nothing will happen. The difference is the guy who's surfing today, that example would be the guy who is willing to go to a nightclub on a day with coronavirus is at a peak. But then the responsibility of that person is that he will go home and he will infect everybody. So you infect one person and then you increase the infection rate significantly. So it's tough. We're gonna have to tough it up. We're gonna have to stay home or move the least possible.
Now, I know one question people are thinking about is if you're a factory worker or you're delivering, you could be for Amazon, Walmart, UPS, are you more at risk? And you know, some of the studies share how long COVID-19 stays on surfaces, but nobody knows. You know, I get a lot of Amazon boxes, for example. I actually disinfect them before I touch them because I'm not going to take a risk because I have a family member that has a chronic condition. But how at risk are the manufacturing people that have to be at their jobs? They can't work remotely, or the delivery people, and what considerations should they be thinking about?
The factory worker is certainly a higher risk than the delivery guy. The delivery guy is the one who is at the least risk because he usually works on his own and he's only with himself, except for the time in which he's getting his truck loaded. The factory workers, they are people who are at risk, obviously, because they work close together. And I think that if feasible, they should have protective equipment, and if they are if they were in contact with somebody who was sick, and I think that those factories should have some form of a process to try to ask them on a daily basis, anybody at home with cough, anybody at home with fever, and they should not allow anybody back at home at their work until they are clear from symptoms. And in that situation, rapid testing would help so much, because if we did have rapid tested inside, like in 2 or 3 hours, then that person could go back to work immediately. Regarding deliveries, you're right. Fomites are inert substances like your cardboard or your computer that can harbor the virus for a number of hours. We know, for example, norovirus, which is a cause of diarrhea, survive for longer hours than most viruses. This virus probably is 4 to 6 hours, but you don't know who was the last who touched it. But it's much higher the risk if you go to a supermarket to pick 100 items than the ones that you get at home.
Mm-hmm. If we shift over and look at kids again, with the new study that just came out, with one child, 14-year-old dying, and also of the cases, there were 40 children under the age of 12 months and 125 under the age of 5, where they had a very serious illness, and there were 13 children with critical respiratory or organ failure. How does this change the game? Because I've been dealing with so many parents, even family members who have kids, that were like, there's nothing I can do. They're going to catch it. They're going to play with other kids. All the studies, all the reports show, there's no risk to kids at all. Because I think it's, this is an, important issue. What would you tell, those parents out there?
I would tell them for the next 2 or 3 weeks, stay home.
Mm-hmm.
It's very.
What if the answer is, I have a 2 and a 4 and a 6-year-old? Jonathan, you can't stay home. That's not possible.
Well, if you go elsewhere, you go to a place that you will be in contact with anyone. You can walk in the street. I take my granddaughter to walk outside. I'm fortunate enough to live in a neighborhood in which I can do that, but I again, use common sense, minimize contact with other people.
Mm-hmm. It's important. I think there's there's been a disconnect, and the narrative is changing. So for several months, for example, our organization knew this is coming. We were following what was closely going on in China and South Korea. I think here in the US, and this also in a lot of other countries, there's a disconnect. People say, oh, we only have 1 case, we have no cases. At the end of the day, we know this is everywhere. It's going to be everywhere. And people are now starting to say, we're closing our office. I'm going to work remote for 2 weeks. Or this event has been canceled. This conference has been canceled. We're going to be doing it in July. And I think there's a total lack of reality of how long this is going to last, because as you know, a lot of businesses are going to be disrupted. There's going to be a lot of bankrupt companies out there, industries that are going to change. People aren't going to, in the short term, want to go to malls, want to go shopping. The housing market, is unfortunately going to have a huge hit because people aren't going to want to buy homes. People selling homes are going to want potential COVID-19 patients coming into their home. But I'm just really still shocked with people thinking we're working remote for 2 weeks. And these are even organizations like huge insurance consulting firms or agencies that are advising the employers. When I know I'm ready for it's going to be a couple months of actually being at home, potentially not going out. What do you think the reality is going to be for everyone?
I don't know. I think it depends on how well the containment works and whether our numbers are similar to the numbers that they had in other countries. Every country has a different health system reality. And I was surprised at how relatively quickly, if true, was the epidemic contained in China. Uh-huh. If you think about it, if you were told by January 30th that by March 1st they were only going to have 30 new cases per day in China, I just couldn't. That was the most optimistic epidemiologists couldn't have predicted that. And I'm very curious to see what will happen in April in China. If by end of March, mid-April, they do not have new cases, I would be very optimistic of us rebounding fast and the rest of the world doing the same thing. If we start seeing new cases, then that would be more worrisome. it is just interesting for me as a pediatrician because I had seen so many infections and I had read so much about this one in particular, and I have not seen one patient yet, that maybe you ask me next week after I see a couple of patients and I'm very scared and I have a very different tone of voice after start seeing the patients.
Mm-hmm. Great. Well, really want to thank you for your time. I know you're very busy, and want to wish you the best of luck with. I think it's going to be a very intense couple months for you. And thank you for sharing your knowledge with everyone.
Thank you. Have a great one.
Take care.